Nobody wants to think about getting old and sick, but here's the uncomfortable truth. Healthcare will probably be your single biggest expense in retirement, and most people have absolutely no idea what's coming. We're talking about a number so large, it makes your mortgage look like a rounding error. A couple retiring today at 65 can expect to spend, on average, $315,000 on healthcare over the course of their retirement. And that figure doesn't even include long-term care. Let that sink in for a second. That's not a worst-case scenario. That's the median. The reason this blindsides so many people is that we spend our working years with employer-sponsored insurance acting like a financial shock absorber. And then one day, the job ends, and suddenly you're staring at the full, unfiltered cost of being a human body. It's like driving a car your whole life without ever seeing the fuel bill because your boss was quietly paying it. Medicare kicks in at 65, and a lot of people exhale thinking the hard part is over. But Medicare only covers roughly 60 to 70% of your healthcare costs in retirement. The rest, premiums, copays, deductibles, dental, vision, hearing, lands squarely on your shoulders. There was this golden moment in the early 2000s when people were retiring on pensions with retiree health benefits baked in. And the financial planning world was almost cheerful about retirement healthcare costs. That era is essentially extinct now. And what replaced it is a patchwork system that rewards people who plan obsessively and punishes people who assume it'll work out. Fidelity, Vanguard, HealthView Services, every major research house runs these projections. And the numbers keep climbing faster than general inflation because medical inflation is its own beast entirely. Think of it like compound interest working against you. Healthcare costs have historically grown at roughly 5 to 6% annually, which means they double roughly every 12 to 14 years. Here's the cycle nobody warns you about. Every generation enters retirement underestimating these costs, gets hit with reality, and the next generation watches and still underestimates them anyway. It's financial amnesia with a recurring subscription fee. One of the biggest misconceptions is that Medicaid will catch you if things get really bad, and it will, but only after you've spent down nearly all of your assets first. Long-term care alone, which Medicare barely touches, costs an average of $108,000 per year for a private nursing home room as of 2024. The practical lesson history keeps teaching us is that the people who survive retirement healthcare costs intact are the ones who treated it as a dedicated line item, not a vague afterthought. Max out your health savings account every single year you're eligible. It's the only triple tax advantage account in existence, and money invested in it compounds tax-free specifically for medical expenses. Beyond the HSA, the strategic move is to plan your income in retirement carefully because your Medicare Part B and Part D premiums are income-based through something called IRMA, Income-Related Monthly Adjustment Amount. In other words, how much you withdraw and when you withdraw, it can literally change how much you pay for Medicare. So the strategy is not just about saving, it's about sequencing. Discipline here doesn't mean fear. It means building a healthcare bucket in your retirement plan with a specific dollar target. Ideally, working backward from actuarial life expectancy tables and your family health history. You don't have to predict the future perfectly. You just have to make sure an imperfect future doesn't financially erase you. The philosophical truth underneath all of this is that retirement planning is really just risk management wearing a cardigan. You can't control your health, but you can control your preparation, your positioning, and your willingness to take the whole thing seriously before the bills start arriving. Some people will stay healthy into their 90s and spend far less than they saved, and that's not a failure. That's a win with a great consolation prize. Others will face serious illness early and be grateful every single day they had the foresight to build a buffer, because the alternative is making medical decisions based on money instead of need. No spreadsheet can perfectly predict your healthcare costs in retirement, but not having a spreadsheet at all is how people end up making devastating decisions in their 70s with no good options left. The goal isn't certainty. The goal is to make uncertainty survivable. Whether you're mapping out your retirement income strategy, your real estate holdings, or the right lending structure to build long-term wealth, we can help you get started. Check out our links in the description below.